person, because last month when I saw him, he never wanted an in-person visit. And so I said, all right, you know what? I'm going to try and see him today. And when I went in, it was the same situation, the living condition was just like, sad. It was an apartment. I walked in and everything was all over. When you talk about lunch boxes for days, and then he has a wife who, not a wife, a sister who was in rehab, and she is, immobile as well. So you have two persons living in a home, just sitting, eating, putting things right beside, and you just have like shelves of, quote unquote garbage all over. And then not to mention, there were like roaches running around. And I'm like, oh my word, how can persons be living in this kind of situation? So it is very sad a lot of days, just by the population and what we are having to deal with. Okay.
100%.
Okay. So in terms of, your day, how do you normally, in terms of coping? I know you say you do a lot of debriefing. What kind of, how do you handle your stress levels, throughout the week or the day, working as a nurse practitioner or as a nurse?
I would mostly say my faith. It definitely helps me to like just renew my mind every day, and honestly has put me in a position of gratitude where like I could have a rough day, but I find the goodness in so many things.
Exactly.
And I think that's what House Calls has done. It has humbled me so much. And yeah, and I try not to take it personal. But sometimes it takes a couple hours not to take it personal because it's difficult. It's definitely difficult, but yeah, I just try to stay grateful.
That's so true. Yeah. Because a lot of times I go in, sometimes in as much as you probably want the patients to be doing this and they're not able to do it, and then it's like you're educating them, but then they're getting upset, at you. You just have to kind of, understand from their perspective, what's happening. So it's very important that, you just have to think, as if you're in the patient's shoe at all times and just understand them. So forgive them at times whenever they get upset about certain things.
Exactly. And oftentimes, like sometimes I have patients who are really resistant when I come in, even to the point where I have to ask myself, like, am I safe here? And just being compassionate. At the end, a lot of the times they apologize.
Yeah.
And that's like really trying to stay objective, not take things personal, and don't treat people how they're treating you, because you don't really realize the full scope of what's causing their behavior.
Yeah, that's so true.